75 years ago, you guys made the brilliant decision to use your tax money to pay for the NHS. And it transformed the wealth and health of this country, for generations. I come from the United States. We did not make the same decision. We have basically a privatized system with some other band-aids for older people and for poorer people. That is very much a two-tier system. And you guys made the right decision to fund the NHS properly, and we are now here on the 75th anniversary with 7.5 million people on the waiting list, the longest waiting list in NHS history. Patients are just absolutely suffering. When we see them, they are waiting, weeks to see a GP. They are waiting, 15 hours sometimes to be seen in A&E. Cancer referrals haven't hit those targets in 8 years or something like that. And people are waiting, months to get their cancer referrals. And so we have a system now where 10 years ago, it was ranked the number one healthcare system on the planet by the Commonwealth Fund, to now where, we are performing among the worst in Europe. And so it's a terribly difficult time to be commemorating the 75th anniversary. As somebody that didn't grow up here, I value the NHS more than a lot of people can just comprehend. Because when you have family members and friends that have, been harmed by American healthcare, harmed by terrible, terrible medical bills, you'll be desperate for something else. And the NHS is a beautiful system. You guys have it. And you have an incredible fighter in Holly Turner here.
Firebrand, revolutionary.
Exactly.
Yeah, like Liam, you mentioned like the misery, and there is that, but it's also an incredibly rewarding experience to work in the NHS, which is why we do it. But I think I've worked in the NHS as a nurse for around 15 years. I work in child and adolescent services with children from age 5 and up. And it is increasingly challenging. And I think we've watched the managed decline across the NHS in the time that I've worked in it. Things have progressively got harder. Posts go out to advert, no one applies. We've just put out a load of jobs in my team again that we're just not getting any applicants for. And the waiting list just continue to grow. And then by the time you get to those patients, for the children I work with, for them to be incredibly complex children with neurodevelopmental disorders, for them to sit for up to 18 months on the waiting list, and by the time they actually reach us, it's very hard to implement the strategies and do the job that you really, really need to do. It's really upsetting because you can see that if I just got in there sooner, if I just had the opportunity to access them when the referral came in, things could have been different. So it's incredibly hard, and it's progressively got worse and worse and worse. And we've been watching this unfold, and it really is at crisis point. And more of my colleagues are leaving for various reasons. Private sector, going overseas, completely changing jobs. And I can see why they are. My husband and I, he's a nurse as well, and it's immense pressure. And we talk all the time about what our future looks like as nurses working in the NHS. And we love our jobs, but something needs to shift. And I think that's why you've got so many staff striking and organising for change, because if we don't get some urgent action, I don't want to say it will collapse. I think it is collapsing.
It is, absolutely.